Unshelling Medicine Podcast. Healthcare in the language we understand.
Hello, welcome back, everybody. Today, I have the pleasure of meeting with Laura Kelly today. Laura, welcome.
Thank you. Happy to be here. Happy to talk.
Thank you for coming. So, we pride ourselves on giving people alternative, letting people know at least they have alternative. And Laura's just the one person that can guide you in a direction if you choose to want to learn, to either change your lifestyle or maybe try to adjust something in your life. So, Laura, can you please tell our audience what your specialty is? We'd love for you to tell us.
Sure. My specialty is really health management, sort of from a primary care perspective, but it's nutritional and natural medicine, but through precision. So it's a really combination of high technology, genetics, and high biomarker testing with personalized natural medicine. I find that this is the best way to sustain health, in fact, is using the substances that are natural, that our body works with naturally.
Okay. So you mentioned primary care perspective. So are you working in collaboration with primary care providers? Do you consider yourself a primary care provider? And what is your medical background?
Sure. Well, my license is as a primary care provider in the state of California. I'm a doctor of Oriental medicine, and this is a 7-year degree. So we go through a master's program, and then we go through a doctoral program with a residency. So it is quite extensive, and it's considered an integrative degree. My license, I'm allowed to order lab tests, but I'm not allowed to prescribe pharmaceutical medication. But everything outside of pharmaceutical medication is my purview. So the approach, I think, in California is that we can operate as a primary care provider from the billing standpoint of insurance.
Okay.
But my take on that is, from a natural and nutritional medicine standpoint, that's to me, this is the foundation of health, right? It's the foundation of all health. It's the foundation of recovery from any chronic disease. It's the foundation of chronic disease management. It's the foundation of prevention. It's the foundation of everything. So if you really are talking about fundamental medicine, which I think is what primary care should be, we're talking about natural nutritional medicine personalized and targeted to exactly that person. Because at this point in medicine and technology, we have access to massive amounts of what's called omic data, right? We can look at what proteins you're making, what your genetics are, what your genetics for nutrition are, what your genetics for chronic disease are. We know all of that right now. So we can take that information and from a primary care perspective, say, okay, how do we level you up to fully stable, right? Naturally in nutritional medicine. If you have, they're called polymorphisms, they're like small mutations in nutritional transformation because you don't use the nutrients in the form you eat them. They have to go through transformations that rely on genetics. So every time you have a gene, you have the opportunity for it not to work or to work partially. So we have to understand that about this very foundational function of your body. And once we understand where you need what type of nutritional support, then we can create a very solid foundation for you. And once you do that, then you say, okay, now what is this person? What are their risk factors? Are they at risk of diabetes? Are they at risk of heart disease? What are the genetic risks that they carry? And then you can work on actual prevention. But you're working on prevention from a place where their body is already engaged to be powerful.
Right.
So it's a very, step-by-step process. But to me, this is true primary care, right? Because I'm sending that person out into the world with a solid foundation and with knowledge of how to hopefully prevent the diseases that they may get. And I feel very good about that, That's how I treat.
Okay, beautiful. Thank you so much for that insight. So I understand the foundational level of prevention, right? So if you're genetically predisposed to, say, any chronic disease, you mentioned diabetes being one of them, is not the only one. For somebody who has, say, a familial history of it and who's trying to prevent this, working with you and, getting themselves to a place where they're regulating their lifestyle and also their eating habit is very useful. So how about, say whoever is listening who has a chronic condition, say high blood pressure or even diabetes itself, and they've already been diagnosed. However, the traditional pharmaceuticals are not working well to control, their condition. From your perspective of primary care and treatment, is there anything that can be useful for this population of patients who are either looking to manage, an already existing chronic condition or reverse it? Right? Because, when it comes to diabetes, lifestyle change can actually reverse it. Not a lot of people talk about it. So what is your take from that perspective of a disease process already existing?
The good thing about this type of medicine is that it's the same, whether it's prevention or treatment. It just is sort of therapeutic doses or things like this. So, let's just talk about diabetes because it's so prevalent and it's so preventable, right? I think the American Diabetes Association, now don't quote me on this, but it's 80 to 90% they think is of type 2. We're speaking about type 2. We're not speaking about autoimmune type 1.
Right.
We're speaking about type 2 lifestyle acquired diabetes. I think they're saying 80 to 90% preventable or reversible with lifestyle, nutrition, and exercise. So that's makes it clear that this is something that we can modulate, right? So when somebody already is involved in the disease process like diabetes, there are probably 50 natural approaches that can be applied depending on sort of the nature of their experience. How much beta cell function do they have left, right? What stage of insulin resistance are they at, right? How close? So there's scales of information on how advanced the diabetes is. And then the natural products work in very different ways. There are some natural products that slowly over time can increase beta cell function, which will increase insulin production. There are some natural products that are going to help keep the blood sugar lower in the blood. So there are different phases of treatment. And some of the natural products you might take before you eat, and some of them that you might take after you eat. So there's quite a lot of information around how to manage blood sugar from a natural perspective. And then my approach with people, and as we know, any medicines, right? These are medicines, natural medicines. No medicines, barely any medicines, I should say, work for everybody. So there are going to be personalizations that are required for medicines, and I think this should apply to all medicine, including conventional medicine, where we may say, let's try this, and if we have some effect but not complete effect, then we'll change and try something else, because there are different patterns, and we may learn something from that person's experience with the natural products, and then we might apply that to a second trial. So from a perspective of treating chronic disease, natural products will do this. So the thing I think that you mentioned earlier when we were speaking is of this concept of choice. And I think this is a great time to mention that. I had this thought the other day, which is that in the United States, medicine is for profit.
Yes.
So if medicine is for profit, just like yogurt, just like a car, then do you go out and just buy whatever car is sitting there? You don't. You say, what do I need? What do I need out of that car? I have a family. I need a minivan. I'm, 60 and I have a lot of money. I want a race car, right? You make your decisions about where you're going to purchase based on the appropriate commodity for what you need. And I think that there is a space to consider this idea in medicine, because it is definitely the case that if I get in a car accident, I want to go to the hospital and I want to be seen by a great team of MDs and surgeons. That is absolutely my choice. Don't come to me for that, right? But if I want to prevent or manage a chronic condition for which that medicine has maybe some answers, but not a lot of experience. And there are other options that are actually, dare I say, better.
Wow.
Maybe I want to consider the appropriate medicine for the condition or for the experience that I'm having. And I think thinking about medicine as a for-profit business opens up the space to say, are there other ways that I can employ medicine for myself in a smart way? And I think that providing knowledge around the things that are available is vital at this time, especially with upwards of 60%, almost 70% of Americans carrying at least one chronic disease. Mm-hmm. So there have to be options, I think, and there are options. And that's one of the reasons why I write books, is because I think it's really important for people to be able to not only have the knowledge of that there are other things to do and other choices that I can make, but also within my books, I'm such a huge proponent of self-care because it's often not the care is often not provided in the conventional space because prevention is not part of the paradigm. And I think that falls to then the individual to employ self-care. But it's very hard to employ self-care when you don't really know what to do, right? So writing books enables me to not only share what's available, but here is some really real guidelines on how you can actually manage yourself.
So like with the books, I love what you said about profit, and I want to talk about that. That's the next area I want to delve into. But, talking about the books, I think very much in today's healthcare, a lot of the holistic practices and a lot of the other choices in addition to modern medicine has been left to the everyday medical healthcare recipients to make for themselves. It's not something that is routinely recommended. You wouldn't go to do your annual physical and your provider recommends massage, right? It doesn't quite happen, right? Yes, if you come in with, stiff muscles and, limited range of motion, you may be sent for physical therapy, right? And, and depending on the degree of muscle involvement or, whether gross or fine motor, you may be sent for occupational therapy. And that's where it ends. So the concept of profit or profitability in healthcare is one that I think has been in some ways detrimental to the healthcare system, because the same instance, which is why I'm in the space that I am in, right? The same level of application that we have, like the conveyor belt approach, right? Where patients are coming in and they're getting discharged because, they had same-day surgery and all of that stuff. And we're not taking time to really see, as long as they're hemodynamically stable, they're fine. They can go home. But what happens after they leave the hospital setting? So this is why insurance companies have the quality measures of less than 30 days rehospitalization rates are either not paid or paid partially, right? So what is your stance in working with, or what would your suggestion be, especially when it comes to the profit margin? Because healthcare most hospitals are losing money. Okay. In attempts to get many people in, they're also losing money on the back end because of this hospitalization rate. What would your recommendation be for payers? Okay. Insurance agency, whether private or CMS, on pulling in a preventative measures? Yes, we talk about it, but I don't see it really. We've come a long way from where we were. We still have a longer way to go. So what is your take on that? On actually focusing on the payers who are trying to mitigate costs, right? By not paying for on the 30-day rehospitalization, by not, completely reimbursing providers for not managing a chronic disease well, by, seeing this diabetes patient, for instance, their A1C is steadily going up every 3 months, right? So what would be the message to mitigate this and pull in more foundational treatment options like you practice?
Sure. Well, as it turns out, I'm a doer. So one of the things that I did was I started writing these books, and then I thought, well, wait a minute. What I need is this genetic test and I need this nutritional test for my patients. And then I sent them out and I said, go to your doctor and get them to order this nutrition test for you so we can understand your nutrition and we can understand your genetics and then we can treat you.
Right.
And what came back was my doctor won't order a nutrition test. So I created an online digital platform that allows the patient or the user, the person who wants to take care of themselves in this way,
right.
to go on and order a nutrition test and order a genetic test. And the platform then correlates that information and comes out with a shopping list, whether that's food-based or whether that's supplement-based. And it's geared, the first module that we built is geared towards bone health because that's what my books are about. But
Right.
this modular application can be used for diabetes. It can be used for cardiovascular disease. So I built this platform and I spoke with one of the board members at United Health. And I said, listen, what do you think about this? What do you think about United Health, employing a platform like this for guided wellness with their patients? And he said, if you build this, we're going to buy it from you. Now, he ended up not being part of the conversation anymore for health reasons, in fact. But I think that this is a solution. I mean, these are tests that you do at home. Mm-hmm. So this is not that you have to go somewhere. You can get the kits at home, you do the test at home, and then you get your list. And this isn't medication, right? This is food you're already eating. This is supplements you're already taking. But these are now perfected for your system. And I think that I think it's a long way to go to get people to really employ this as medicine. But I think that if you start, there are early adopters, there are people who are interested in longevity, and you start building it out that way. And I think if you could do that, I think that this is a perfect thing to do through payers, through healthcare, through insurance.
Right. Because that would have been my next question. Did you have any insurance buy-in, or the people who are interested in getting this test done are paying out of pocket?
Well, currently they're paying out of pocket. Again, the genetic test is out of Stanford Lab, so it's not in the normal medical. So it's not expensive though. I mean, genetics used to be $10,000 for a run. This is $200. So things have changed greatly in terms of genetics. But I mean, my goal with this work, right, writing books and sharing self-care and teaching people how to care for themselves, and then providing a way for them to actually gather the data, my goal is to get coverage for this, right? Is to step up and work with insurance companies. I mean, again, this is just all built now. So I'm just starting the journey of taking this all out and getting coverage. And truthfully, we can't get coverage for this until we have enough data, right? So that's why we're building our data out.
Okay, great. I mean, it's great that it's 200, but 200 for somebody could be nothing, and for the next person could be the difference between paying rent, feeding their children, or keeping their lights on. So that's why it's something like this. And the population, unfortunately, who need this the most are the population of patients that cannot afford to pay that 200 to get this testing done. Right. So, population of patients who are below the poverty line or within that poverty bracket that are Medicaid, Medicare, the population of patients that are high utilizers of insurance because, again, they don't have enough access to healthcare that they need to manage themselves. And unfortunately, these are the population of patients that are often written off as non-compliant. It's not like they don't want to do better. They don't know how to do better. They don't have access to tools to help them. And this will be something wonderful, right? To help them. It'll help the insurance companies save money, by this. Right. This patient's not getting chronically ill all the time because they have a chronic condition, right? So, back and forth, ping-ponging back and forth to the hospital. That's a big bill, okay? I work for insurance, and there's certain patients that are, tagged as high utilizers, right? So this will actually help insurance companies save money, more of a better profit margin rather than, paying that $30,000, $40,000 hospitalization bill, pay for a program like this, that is $200 so that this can actually be used by a nurse case manager to manage this patient's needs, you know?
Yep. I mean, there's plenty of documented, the literature around going back, recidivism, going back to the hospital after leaving the hospital. Right. And proper nutrition is is there already, right? We already know that somebody who is given proper nutrition tends not to go back to the hospital. So that's all documented. Like all of the groundwork for this application is there.
Right.
It's all proven. Right. So I think that, the point of getting coverage for all of this stuff is exactly to your point, that the people who need this the most are the ones who are not going to be able to afford it. So, I mean, that's why I'm on this long, slow train journey that I'm on, which is starting with a 4-person case report, right? And then we're going to do 20, and then we're going to do 50, and then we're going to finally maybe have enough data after 5 years to be able to have the conversation for coverage. Right. And that's just how it works, right? I mean, we know it works. There's tons of research on nutrition. It's not like this is rocket science, right? I mean, it's there. but somebody has to make the data set, right? And that's my job, is to make the data set so that the people who need the help can get it.
I really do appreciate that you're doing this work, because it's something that is absolutely necessary. It's so basic and so simple, but not basic and simple all at the same time. So, the work is, nature laid it out for us, but the decision maker, the stakeholders need that raw data to really show that it really works. So I thank you for actually going to develop this software where people can actually go and request their tests. It's something that sounds really useful, especially for people who know either their family history or based on their own health history, want to do a little better. It's really great work.
Well, I mean, technically what this is to me is we're born with a body that's kind of a black box, right? And until we had a whole genome sequence, until we had genetics, who knows what's going to happen, right? So this is my sort of beginning attempt at a user's handbook, right? Here's the user's handbook of your body on a very basic level, because you have to eat every day, and you're going to have things that are not going to process properly, and you're going to have gut health problems because you live in America. Yeah. And we all have gut health problems for various reasons that we could talk about.
That's a different topic.
Another day.
Microbiomes are depleted. So
totally. And guess how you process half of your nutrition. So, and guess how you keep your brain healthy, right? Your microbiome. So there's a lot to be said around that. But all of this is something that you have to know. This is actually information that if you don't know it about yourself, it's going to be you guessing about how you treat yourself. So here's a little beginning of a handbook on you. And if I can expand that to gather more and more data and information and continue, I get that covered too, then what we end up with is coverage for your handbook for your own body.
Right.
And then you can actually have a chance of being healthy, I think. And I think that in America, that's a challenge, frankly.
It is a challenge because we live in a very highly industrialized society. We're often going and going and going and not going anywhere fast. And, with fast food on every corner, it doesn't make things easy, right? Bad eating habits, poor food choices. And, all that combination is just lethal for anybody. So it is something, a handbook is helpful, Yes, we can go to, IKEA and buy furniture. Okay. You can practically put it together, but those instructions come in handy, right? They may not all be in English, but we can figure it out, So I think that would be super helpful. I know for me, it would be. So let's talk about the journey. I know that we started having this conversation before we got on here, and your focus is mostly on bone health. So how did this start for you?
It started because of my mother. I was in my 7th year of school, which is the last year of school. And my mother called me in a panic and said, my doctor is firing me because I don't want to take the medication. So I said, oh God, I'm in my last year of school and I'm really, really going like this and I have to help her. So I took a fracture map. I looked at fracture maps of the world over time from the World Health Organization and saw over time, the diet, I knew what's happening dietarily in Asia, for example, like they're adopting more of a Western diet, things like this. So you can sort of gauge over time as diets transitioned what happened to chronic disease levels.
Right.
So I looked at bone health and fracture rate and correlated them with these diets and put together a list of 9 things for her to do dietarily that were going to help her bone density, theoretically. So she did 3 of these, and then we retested her bone density 15 months later. And for the first time, she had stopped the bone loss. So her doctor said it was a fluke, and we said, whatever. And we kept going with our program. And then after the next density scan, she had climbed up, and we knew that we were solving the problem. So I got a phone call from her cardiologist and then ended up writing a book. So we wrote a book for mothers, for people to take care of themselves, because this is natural nutritional medicine that you do, right? I'm a guide in that regard, right? I'm a data-driven guide, but you're the one that's doing the work. So we wrote a book. That book was internationally published. And then my practice became pretty much predominantly women in midlife who wanted natural medicine for bones because they didn't want to take pharmaceuticals. So I developed a program based on data with genetics out of a Stanford University lab and nutrition testing to be able to put together this basic handbook for you. But then also on top of that, layer over the mechanisms of bone growth. Right. Because there are all of the body's, the way that we generate tissue has mechanisms. And so there are certain mechanisms involved in either growing bone or losing bone. And so understanding how that mechanism is triggered, and all the mechanisms in the body are triggered by 2 things, nutrients and oxygen. So if you're breathing, then we know that's taken care of. And now we need to understand the targeted nutrition for the mechanisms of bone health. So that information is sorted out, right? I've understood those mechanisms, applied the right nutrients, and then we have bone growth in pretty much everybody.
Right.
I mean, it's going to depend on your genetics a lot. Genetics is going to be 50% of your outcome, but that leaves 50% that we can change.
Right.
And I would say every person that I've ever worked with has some improvement, even if it's small. And the other concept is that the scanning that's done for bone health for midlife women is a density scan, but it doesn't look at bone quality. And you can have smaller bones, but if they're of high quality, they're unlikely to fracture. So there's this whole space from the conventional standpoint that's unexplored. And in my very direct experience, I have plenty of patients who are small and small boned. And I had the first greatest test of the function of this approach was when I had one of these women. She's very small. She had fractured her tibia previously trying to play tennis, came in terrified that she was never going to be able to walk again, right? Or go outside or do anything. And so we worked for 2 years. And then she was on I think it was a Segway, one of those things that moves automatically, right? And she jammed her leg. She fell off and jammed the Segway into one of these metal posts that are in like a sidewalk, slammed into it at 30 miles an hour, and then fell on the ground. And she did not fracture anything. And I said to her, well, regardless of what your density test says, because your density test is saying you should be on drugs, but your bone quality is obviously great because nothing happened to you. So that's
Did you bubble wrap her after that? Because she just seemed to be prone to accidents.
Funny. No, actually, I didn't think about that. But now that you mention it, I should check on her.
You should.
But she's great now. She's playing tennis. She's super happy. She's not afraid anymore, right? And she gets a density scan and they say, you need to go on medication. And she says, yeah, I'm fine. Right. So there's all this work that happens.
Yeah. So for the people who are listening who may not know why you're zeroing in on middle-aged women, can you a little bit explain that maybe to an average person who may not understand why middle-aged women are prone to either losing their bone density or getting fractured?
Sure. Estrogen is one of the main triggers of a mechanism that helps bone to stay in a generation process. So bone itself is not, I think we all think of bone and it's sort of like there and it's hard and it's just there. It's actually a living tissue, just like all of our living tissues. And in fact, on a daily basis is generating and breaking down and generating and breaking down and generating and breaking down. Say if you're an athlete or you are a very busy person and you're running around, you're going to have very, very tiny microfractures in your bones as a normal part of living. And the body's going to say, okay, there's some damaged bone. We're going to clean it out. And then we're going to build more bone in its place. And so healthy bone tissue is in a state of constant turnover, but there's a little more generation than there is loss. Once you hit middle age as a woman and your estrogen declines, then that mechanism is no longer being properly defensive for bone generation. And so you can go into a state of a little bit of bone loss. And most women have a little bit of bone loss when they have estrogen loss. Unfortunately, what happens if that's on top of nutritional deficiencies is that bone loss becomes much more severe. And this is a really important point for me, is that osteoporosis is talked about as a disease. And in my extensive experience working with this, it's not a disease, it's a deficiency. And I think that a majority of chronic conditions are deficiencies rather than diseases, but you need to understand the deficiencies in order to treat them. So again, as you age, middle-aged women are going to lose their estrogen, and this is going to start that process. So that's why osteoporosis hits this demographic. It also does affect men, but men go through andropause, which is where they start to lower their hormones, their testosterone primarily, traditionally at around age 70. So you're not going to have such an early bone loss. Men can also experience bone loss if they're on medication to block estrogen, the transformation of testosterone to estrogen that a lot of men will be put on for prostate issues. They also end up with bone loss as well.
Okay. Thank you for expanding on that. And I wanted that knowledge injection into anybody who's listening, be a son, a nephew, a brother, and you want to understand why women in middle age experience bone loss from a scan. This is why, because estrogen depletion. One of the many fun things we go through.
That's right.
So let's talk about Oriental medicine. I've been very fascinated by, herbal medicine in general, and it's a lot of medicine that is rooted in tradition. So in your experience, whether in school or in your practice, is it important to take into account medicinal components, be it food, be it spices, be it herbs that different regions of the world also use in healing or treating themselves?
I mean, the wonderful thing about traditional cuisines is that they actually are medicinal, right? So, I mean, I know more about Ayurvedic and, continental Indian cuisine than I know about Nigerian cuisine. So you could tell me about the traditional medicines that are involved in everyday cooking. I'd love to know.
Right.
But, the traditional diets are often plant-based or at least have a large plant-based component. But the spices themselves are what we now know in the West to be medicinal substances.
Right.
So, things like turmeric is a massive nutritional, the effects on the body are so positive that the extracts of this can be used as a medicine, right? So I think that the daily intake of these medicines goes a long way in you're treating yourself on a daily basis by cooking, right? I mean, what a great natural thing to happen, right? So that is sort of the basis of, that's the real food as medicine basis, is that when you have a cuisine that incorporates medicinal substances naturally, on a daily basis, you've up-leveled yourself, right? And then when you have a traditional approach, which is a group of people over thousands of years have come to understand which plants do what and put them into categories and then treated patients and then kept all the case reports. So you can then go back and understand why this medicine works and how this medicine works. And then key point with traditional medicines is not only the idea of applying a medicine to a problem, right? Which is what modern medicine says, your problem is this, here's the medicine. Traditional medicines apply the medicine to the person. So not only does the traditional medicine go towards the problem, but it also takes into account the constitution of the person in which the medicine will be put. So it's in that regard a more complex diagnosis process, which I don't think a lot of people are aware, because we are not only, again, saying, okay, you have a cold, take this pill. We're saying you have a cold and your body is hot on the inside and cold on the outside, right? And you're sweating a lot, even though it doesn't make any sense because you're cold, right? So it takes into account all of these pieces and says, what's happening in the system? So I don't throw a medicine at the system that's going to actually send it in the wrong direction. So that's the sort of foundation of treating from a traditional medicine standpoint is again, it's actually quite complex. And I think that's why, 7 years of schooling is a long time, because you have to come out of that with a very complicated understanding of diagnostics.
You're right. I couldn't agree more. You treat yourself every day. We're quick to buy multivitamins. The West, we love multivitamins that come in a bottle, right? And, but we go to the store and we walk clean past the ginger, right? We walk clean past the garlic, we walk clean past, even curry. Right? The dill, exactly. Right? Oregano is not just a flavoring, right? Oregano is a very powerful herb, right? Yep. So there's so much healing that happens with food that I am learning. I'm learning and I'm working on changing habits and, incorporating a lot of things. But this happened as a result of personal research, just exposing myself to different things. So the reason I asked that question about different region and food practices or medicinal practices when it comes to plants, right, is because I have noticed a thread and also differences in herbs that are native to, say, the Caribbean, right? And herbs that are native to Nigeria, which is just a sliver of the whole African continent, right? And growing up, in the West, the practice of putting cabbage in the broth, what is that called again? Like a milk duct occlusion. That's the only word that's coming to my head, to relieve the pressure or to release, whatever duct was clogged. There's a traditional medicine that we use in Nigeria as well. If somebody's not producing milk in the Western world, we use formula, we use whatever it is, breast pumps that actually do the manual work. However, back home, there's a herb that you just, pluck, you chew on it, and it naturally releases. And I'm seeing more and more and more. And granted, it's not FDA approved, but more in the Western world, all these things are being accepted. The use of red raspberry leaf tea for, uterus health, right? The use of dates, right? The use of milk tinsel, right? So how does that make you feel as somebody who practices in a way that, brings the holistic or the natural remedy aspect of care into things?
It makes me feel great. I read Western science publications and Medscape and all of the things that your MD probably reads. Right. And yesterday, there were clinical guideline updates. And one of the clinical guideline updates was for major depression. And guess what the first two recommendations are for new clinical guidelines for major depression? Exercise and light therapy. Right? And I read that and I was like, what am I reading? Am I reading which journal is this? And it's Medscape. It's like your main WebMD for doctors, for MDs. And these are the first new clinical guidelines. And I was so happy because the drugs used for depression can be very debilitating for people and not solve the problems.
Right.
So the fact that science is now elucidating and showing that these simple things are actually better for you. And if they work, don't give them the drugs. I mean, how amazing is that, right? It's a fantastic thing. So I am all for people co-opting what I know. Take it, use it. I want to share it. I want everybody to have it, right? So I'm very happy to see medicine moving and being open, right? Open to this and looking at that. And there's a conference, which is the Integrative Medicine Conference, which is put on by the Osher Center, which is a academic institution. And there's one at Harvard and there's one at Stanford. So they're quite, high academic conferences. And they are all about how to move medicine towards whole person medicine, right? And they're not just talking about it either. So I think that there is a big movement in medicine towards this, because I think that everybody knows that the cost of being sick all the time is not sustainable. Mm-hmm. And I think everybody is slowly coming to accept that traditional medicines have a lot of knowledge and there's a lot to offer. So I'm really hoping that we're entering the time where this is happening, right? The integration is happening.
Yes.
What?
Yes, yeah.
I'm doing everything I can to promote that, right?
That's why we're here. That's why we're here, because I think working in tandem and working together beats, the silo isolation type tactics, because it's not benefiting anybody. It's not benefiting the patients. It's not benefiting the health facilities. It's definitely not benefiting the payers, right? If there are options there to benefit everybody, why not use it? Let's try it out. I was pleasantly surprised about 4 years ago. Before that, like a year prior, I started my journey with acupuncture and I was paying out of pocket, right? And then about a year later, I was told that, it's part of your insurance benefit. I was like, okay. I like this, right? So my acupuncture, which is, more holistic, considered holistic, more of an oriental medicine, was actually covered. That's because it works, right? It works. I had very bad thyroid function then, and it kind of really regulated me, right? So I think the more we work together, the more we know that everybody benefits from this. There's no kind of alienating anybody or pushing you out of your craft. If you're good at what you do, you shouldn't worry about losing patients, really. So,
no. And I would never worry about that.
It's like, sometimes is a confusion about, or the saying that all of a sudden, you have everybody moving to, for lack of a better word, non-traditional medicine. It's the same argument that is used sometimes, not all the providers. And for those people who don't use it, kudos. They're not everybody is welcoming to the idea of nurse practitioners being independent practitioners, because patients naturally gravitate towards nurse practitioners, because in nursing, we are taught to consider the whole person, right? Not just hyper-focus on the disease process. So, So just for, we've had really good conversation. We have, Laura, and I'm very happy about having to have sat down with you today. So given that you're licensed in California, right? And if a doctor say in any of the 50 states, and I should say 49 at this point, if any of the 49 states is interested in either collaborating with you or, working with you, or anybody who's listening to this podcast who wants to, work with you on the recommendation. So what are ways that a person could do that, or provider can do that?
Sure. Well, I actually have two licenses. I'm double board certified. So I have a board license in the state of California, and I have a national board license.
Nice.
So I can work all across the United States. There are a couple, I think the state of New York, maybe I can't order testing in, and the state of New Jersey, maybe. I think the New York, New Jersey area, I can't order testing in.
New York, New Jersey, we're special on this side of the world.
Right.
We put you through it. So,
right. But my license is national, and I work with patients all over the United States through telemedicine. I work with patients internationally through telemedicine, which is more of a consult, right? Because I'm not licensed in Europe. And I work with providers. I love working with other doctors, especially doctors in the conventional modern medical space, because I feel like it just works out better for the patient when there's a team, and when there's an integrative team from a natural medicine and a conventional medicine side, and it works. The patient benefits so much from that.
Yeah.
And I think that I benefit from that interaction with another doctor with a different specialty, and they benefit from knowledge from me. And I think everybody wins when you're doing sort of an integrative team approach to healthcare.
I couldn't agree more. I really couldn't agree more. And I know you've talked about collaborating with doctors, and you did mention somebody earlier in the insurance space. With your work and your book so far, do you see any interest from that end of the healthcare spectrum? Because I really do think and believe that a lot, measurable change can actually come if it trickles down that direction.
Yeah, I mean, I wasn't even going to mention this, but I have another book coming out in the fall, which is on the whole opposite side. I'm just like, I need to get this stuff out there. So the Healthy Bones books are for people, for moms, for anybody who wants to take care of their bones. Here's the information laid out clearly for you. It's science, but it's easy. On the other side of the spectrum, and I mentioned this to answer your question, is that so Elsevier is the scientific press. They publish all sorts of journals and science articles, and they have an academic press, which is their Nobel laureates and, science, high science. I am writing a book for their academic press.
Wow.
And it'll be out in November, I believe. And this is a book that they approved, which is how do you take modern conventional medicine and all of the expansions in data, and how do you drive that towards prevention? So this book is geared towards clinicians and scientists, and hopefully MDs that are just getting out of school who have an open mind and want to say, wait a minute, prevention's a really good idea. And we have all this data on the patient. Let's figure out how to create preventive paradigms within modern medicine. So I was surprised that they wanted to publish that book, but they did, and they are. So I think that there's a massive move. And I think, what I did with this book was work with experts in their fields. So experts in genetics, experts in all of these different disciplines, to write chapters and understand how this is going to look if it moves like this, and how can we make it move like that. And every single one of these people who are, heads of departments at universities or hospitals or things like this, all believe 100% that prevention in medicine is the right way to go. Every single one of them.
We know the truth. It may not be popular, but we know the truth. Yeah.
So I think that there's, I think the problem that we have is that everybody knows, everybody agrees that there's a space for this medicine, but it comes up against the economic interests. And I think that, I think figuring out how to either work with the economic interests or I don't know how to solve that problem yet, right? I'm working on it. But I think that that's the problem that we have. I think people want it. I think doctors want it. I think that the establishment of scientists that I've worked with all know it and want it. And then there's the economic interests, such as food policy, regulation of detrimental substances that are being consumed by all of our children. Right? I mean, how do you manage those things? Because you can do all the prevention you want, but if everybody's killing themselves every day, what are you going to do about that? So I think that there is this moment right now of these things kind of facing each other. And I don't know how that resolves.
Right.
But the best I can do is provide all of the information, provide the roadmap, and say, if you want to do this, here's what you do. And then hope that at some point this can get resolved.
Yeah, the resolution of that problem that's a steep hill to climb. It is climbable, but it's really steep because unless you have traveled outside of the United States, it's not glaring how much goes on in the food industry here, right?
Yes.
It hits you in the face. Once you travel out and you're like, what? Even some of the crackers that we eat, yeah, I'm not going to mention a company name. We're not advertising for them. So even certain crackers, the ingredients that are not allowed in other countries, even cereal, the first thing children eat in the morning to go to school. One brand I absolutely love. And I looked at it and one ingredient, just because we're trying to preserve a shelf life, let's forget the human life that is consuming it, Right. It's something that is very much the detriment to our society. We have to work on it. I think the more of us who advocate for one another, advocate for better food choices, for better food manufacturing practices.
Yeah, I think food policy needs to be looked at and overhauled to favor the human instead of the company.
The human doesn't have lobbyists. I guess the companies do. So,
Right.
Well, I'm a human lobbyist. I'll say that. So I'm all for advocacy.
Yes.
I'm all for advocacy and doing the right thing. Yeah, even that on its own, what you're doing is teaching people to pay attention to their label, right? Their food label. That is also a form of
self-care.
Self-care. How many of us really pay attention to what we eat? I'm used to eating this. I'm going to trust the company that is the same ingredient, right? Until one day it really does taste funny. It tastes different. Let me look. And there's usually not a big announcement on when ingredients are changing.
Right. Interesting.
So
I'll tell you something that I noticed in practice, and I think a lot of providers of my type of medicine notice, is that there are patients who can't eat wheat. They have wheat sensitivity or don't feel good when they eat wheat. When they go to Europe, they eat pasta, they eat bread. And they're like, wait a minute, why is it possible for me to do that overseas, but I can't do it in America? And I think that really highlights what you're saying, which is that the food practices and the agricultural practices in the United States are not the same as in countries who protect their citizens. True. And that sounds harsh, but that's actually for real.
That's reality. And, we briefly mentioned microbiome, which, it's a big topic, and we can broach that another time. But, this is one of the big killers, right? We're introducing chemicals that do not naturally belong in our bodies, and we are sending it through our gut, the second brain of the body.
That's right.
We're killing those cells that are supposed to help produce those feel-good hormones that go here, right? And, we're finding that more and more people are, anxious, depressed, and, all these things. Where is that coming from, right? But we don't drill down to, again, like we talked about earlier, the very basic food. And this is such a great conversation. Thank you so much for being here, Laura. I thank you so much for your insight. Thank you so much. This is great. So thank you, everybody, for listening. If you benefited from this conversation, please, if you're in the healthcare space and you really, really, really want to be a voice for change or be a change maker, whether you are a traditional doctor or conventional medicine, please, it is important that we find our tribe and we find people that are really putting patients' need in the forefront. If you're interested in talking to Laura, consulting with Laura, I will leave all her information in the show notes, the links to all her books and a book, and soon to be coming a second book. She is three. Third book. So, links to 2 books, then the third one is on its way. So please, please, please get involved with this conversation. Please let us know what you think. And if you're in a space to help with any of the project that she's working with, please, it would be great to reach out to her to get things going because it benefits all of us. So thank you so much for being here, Laura. It was great having you.
Thank you so much.
Right.
It's really good to talk. Let's talk again.
Thank you. Talk again soon. Bye, everybody. Okay.
Thanks for tuning in to Unshelling Medicine Podcast. If you want to stay up to date with the latest episodes, make sure to hit that subscribe button on your favorite podcast platform. If you enjoyed today's episode, please take a moment to leave us a review. Follow us on social media at Altruistic Scribe on Instagram, TikTok, Facebook, YouTube, and LinkedIn. We share additional tips, updates, and health-related content that you won't want to miss. Have any questions or topics you'd like us to cover in future episodes? Reach out to us at altruisticscribeco.com. We're always eager to hear from our listeners and tackle the health topics that matter most to you. Until next time, stay healthy and take care.